I'm presenting this on behalf of my colleagues, Mark Ewan from Health Action International, Richard Lang from Boston University School of Public Health. As Justine mentioned, why this spotlight on insulin? When you look at the numbers of type 2 diabetes, of obesity that were highlighted at the WHO this morning, or if any of you looked at the BBC or the Guardian or other newspapers yesterday, why focus on this issue? I think what's important to remember is that this life-saving medicine was discovered in 1921, and it was first given to an individual in 1922. And then in the 20s and 30s, it became widely available in the Western world. There have been documented challenges accessing insulin in terms of availability and affordability. And this review article that Mark Ewan, Richard Lang, and myself co-authored in The Lancet Diabetes and Endocrinology highlights some of these. And what's estimated globally is that 100 million people need this life-saving medicine. And what's important is, as Justine mentioned, for type 1 diabetes, insulin is life. Without insulin, people with type 1 diabetes will die in a very short period of time. For type 2 diabetes, there isn't this absolute need. It's needed for better management, and determination of who needs insulin in type 2 diabetes is not as clear-cut as for type 1 diabetes. And as well, I think it's a good signal from the global health community that World Health Day today is focusing on diabetes, because up to now, really, there has been a lack of a global response from WHO, from governments, as well as civil society. So the AXIS study, AXIS stands for Addressing the Challenging Constraints of Insulin Sources and Supply. It's a 3-phase study from 2015 to 2017, and really the idea is to map the insulin markets. And the profiles that we're launching today, and you have copies available, are a profile on the market, a profile on the issue of intellectual property and insulin, a profile on the trade-related issues, one on prices, and one on tariffs and taxes. And we have ongoing work on the issue of biosimilars. So for biologicals, which insulin is a biological, we don't talk about generics, we talk about biosimilars. And so one profile is looking at the regulatory issues around why there is a lack of insulin manufactured by companies that aren't multinationals, and then also looking at industry initiatives. Really, the idea in our next phase is to dig a little deeper in terms of the understanding of who produces insulin, who are these other manufacturers producing insulin, what do they produce, and can they compete on this global market that is dominated by 3 major multinationals, as well as local information on the distribution channels. And for that, we have ongoing right now different surveys on the availability and prices and price components of insulin. So price components are the markups within the supply chain, taxes, duties, and other elements within the supply chain that might increase the price of insulin, as well as visits to biosimilars. And the last element of our project will be developing interventions to improve the issue of insulin. And so the next slides briefly go over some of the findings from these different profiles. So if we look at the insulin markets, the global insulin market was valued at $20.8 billion in 2012, and 88.7% of value was controlled by 3 multinationals, namely Novo Nordisk, Sanofi, and Eli Lilly. Through the work of colleagues at the Boston University School of Public Health, we've identified 39 smaller manufacturers of insulin. We're looking more closely at these manufacturers, but from the data we have, 23 of these companies only sell insulin in one country, so the country where they manufacture. In looking at national essential medicines lists, nearly all countries list both intermediate and short-acting human insulin as recommended by the WHO. And looking at this issue of consumption of insulin in type 2 diabetes, the literature shows that this is between 10 and 25% of people with type 2 diabetes use insulin. Focusing on the trade of insulin, using data from the World Trade Organization, we see that 10 countries made up 98 to 99% of the global value of retail insulin exports. and Germany, Denmark, and France collectively exported between 85 and 96% of insulin over this time period. If we look at imports, 50% of imports go to the US, UK, Germany, and Japan. And around 60 countries, mainly from low and middle income countries, only import insulin from one source. And this really highlights the vulnerability that many low and middle income countries have in terms of the sources of insulin available. Focusing on prices. So the first series of, first on the graph shows the management sciences for health. So these are the best prices available on the global market. And the second is the government price through tender data. And you can see that some countries are actually doing well in terms of the tendering that they do for human insulin. The next series focuses on analog insulins. And for those of you who aren't familiar with analog insulins, these are termed the more modern insulins. These are insulins that have, the insulin molecule has been modified, and they're seen as newer, not necessarily better. And you can see that the higher price, and this higher price is reflected not only at the government price, but also at the patient in the public and private sectors, meaning that an individual needing insulin in the public sector, the range that this data has is from $2.16 US all the way to close to $37 per vial. And an individual will need anywhere from about 13 vials a year, so highlighting that this is clearly unaffordable to many in low and middle income countries. And if we look at analog insulins, you know, the case is even worse, with the range from about $6 per vial all the way up to $250 per vial. And these prices reflect not only the selling price from these companies, but also a variety of markups. We haven't, as I mentioned, we're still looking into these markups and what they represent, but we've looked at tariffs and taxes. The majority of countries that we've studied have no import tariffs on retail insulin. And the proportion of countries that do have tariffs has decreased since 2004 from 52 to 77% of countries not having any tariffs on insulin. If we look at the global weighted average on import tariffs, has decreased from less than 3.5% in 2004 to about 1.9% in 2013. And most of these countries are actually located in Latin America. Looking at VAT, it ranges from 0 to 24%. And you can see that in OECD countries, it's 8.3%, 4.6% in non-OECD high income, and then 7% in both upper and lower middle income countries as well as low income countries. And so this is part of this high price is not only the selling price when this insulin leaves the factory in Denmark, in France, or in Germany, but also these markups within the system. Looking at intellectual property, many of you who are familiar with issues around access to medicines, access to ARVs for HIV/AIDS, the main barrier was intellectual property. This is not the case for insulin. There are no patents on human insulin. And even for analog insulins, most of the patents are expiring within the next few years. Again, looking at the intellectual property, this is owned by three companies I've mentioned before, so Eli Lilly, Sanofi, and Novo Nordisk, as well as what's worrying to a certain extent is the increase on patents on the delivery devices. So the new pens or other devices that are used to deliver insulin, meaning that potentially this could be a barrier, being that people will be stuck with one delivery device for a specific type of insulin. Looking at the way forward is really to better understand what happens on the ground. So finalizing the work on biosimilars regulations and also the industry initiatives, collecting data from the ground to really understand this issue of availability and affordability and the price components, and also meeting with the biosimilar companies. The idea there is to see who they are, what they produce, do they produce a quality product, and can they become a player on the global market. And also to get insulin on the agenda, really, in providing innovations in delivery of insulin and care. So are there new models in terms of how insulin is purchased and supplied? Are there new models in terms of how care is delivered in low and middle income countries? Also, how can we get insulin into universal healthcare coverage, which is a key component of the SDGs, the Sustainable Development Goals, as well as looking at other mechanisms such as pre-qualification, which is WHO putting its stamp of approval on a product, saying that this product is a quality product and safe to be used. And finally, is there the need for a global compact on human insulin? We've seen shifts in the market from human to analog insulin, which is much higher as the price data shows. And so a concern that many people in the diabetes and insulin community have is that vials of human insulin will disappear, meaning that people will not have access to a quality product that is affordable. And finally, really to engage with different stakeholders, and that's part of the reason for having this event today, is we want to share our findings, we want to discuss our findings, and we want to get your perspectives and also the perspectives of the panel that we have here today, representing different points of view on the issue of access to medicines, and really discuss this issue.